My name is Erin Garibaldi, and I do primarily the psych assessments here, as well as individual and group therapy. So psychology was just kind of a fluke thing. I was pre-med for a while, and chemistry is not my thing. And so I was just happened to be taking an abnormal psych class at the time and fell in love. And then addiction in particular, I always wanted to do psych assessments, and Dr. G, our clinical director here, basically came up to me and was like, this is an opportunity for you to do assessments, and just taught me a bit about how drugs can affect the brain, and that if we don't learn about, okay, how did this exactly affect this person, and how is it impacting their life from here out, we're not going to be able to help our clients. And so I just fell in love with the idea of doing assessments to figure out, okay, what damage has been done to this person's brain, and how do they kind of bounce back from it. I think I've become a better therapist just because you have to connect with people who aren't necessarily like you. I'm not an addict myself, but I feel like I'm able to connect with my clients and help them process some pretty heavy stuff. Kind of the normies don't recognize how much someone with an addiction goes through, and how sometimes just using drugs is the only way they can cope with it. And so helping people learn another way of coping through something most people can't even imagine has been a great experience for me. We had this one client who was an Army vet and had gone through so many things with his service and was suffering from PTSD and didn't realize it. And so the very first day we did assessments on him, one of them was our trauma assessment. And that's when he finally connected how much his service had actually impacted him, and that was the reason why he was using. So it was one of the most amazing, touching moments just to see someone finally get that peace that they've been missing for so long. And I believe he's still sober today, so that's an amazing story too, where you can overcome this and move past whatever traumas you have in your life. So many people going through addiction feel like there's no one there on their side, that there's no one there that can help them, and you're not alone. There's so many people that are willing to help you, and all you have to do is reach out and ask for help, and we'll be there for you. It's just the hardest step is recognizing that you need help. Addiction's the hardest disease you can go through. Some people view it as just an excuse to not live life, but you're using for a reason. It's not. Most people aren't using just for fun. You're using due to mental illness, depression, anxiety, traumas, anything, and it's just a way to avoid the pain. And so these clients are the strongest people I've ever, and I feel privileged to have met them and to work with them because they are so strong and they're amazing. And to come through it and then go through this addiction and go through treatment and keep strong is inspiring every day. And if you're having a problem, just don't be afraid to come out and get the help you need.